In this video, we will discuss about body regions, orientations or direction, range of movements, body planes, 4 basic movements in flexibility, types of stretching, body regions. The entire human body is divided into regions, which is known as regional anatomy. Each major region is divided into several smaller regions to aid compartment. Head region. Head houses the brain and major sense organs. Neck region. To primary neck region, anterior and posterior cervical triangles. These are found deep to the skin and subcutaneous tissue and contain several muscles, vasculature and nerves. Trunk region. To major regions of trunk, anterior and posterior trunk. Extremities. The upper extremities are hand, wrist, forearm, elbow, upper arm, and shoulder. The lower extremities are hip, thigh, knee, lower leg, ankle, and foot. Orientations or directions. The first directional term we'll be discussing is anterior. Refers to the position of a structure or body part in relation to something else. Of course, if we have a term for in front of, we must also have a term for the opposite, and that word is posterior, which indicates that a body part is behind something. Distal and proximal. Distal means farthest away from the trunk of the body or the point of origin of the body part. Proximal refers to being close to or near the trunk of the body or the point of origin. Medial and lateral. Medial refers to the center of the body. Lateral refers to the side of the body. Superior and inferior. Superior denotes upwards or towards the vertex or top of body. Inferior denotes downwards or towards the foot.
Range of motion, or ROM, is the measurement of the amount of movement around a specific joint or body part. It is commonly measured during a physical therapy evaluation or during a course of treatment. Other impairments that your physical therapist may measure include strength, gait, flexibility, or balance.
Active range of motion. This is the space in which you move a part of your body using your muscles. You make the effort without the outside help. This is where you have a muscular contraction of the tissues producing the movement without any assistance.
Passive range of motion, or PROM, this is the space in which a part of your body can move when someone or something is creating the movement, such as a massage or physical therapist. You're not the one engaging the muscles you would normally use to start the movement and do the work.
Oftentimes with passive range, you're getting a stretch but no muscular contraction or motor control is necessary to perform movement. Just remember, with passive range of motion, you feel a stretch. With active range of motion, you feel a contraction.
So let's define what is body planes. Body planes are hypothetical geometric planes used to divide the body into sections. They are commonly used to describe the location or direction of bodily structures. They can be used also as reference, which describes relationship between different parts of the body with relation to the center of the body. There are 3 major body planes, namely coronal or frontal plane, transverse plane, and sagittal plane. Now first, the coronal or frontal plane. This plane is a vertical plane running from side to side that divides the body or any of its parts into dorsal and ventral portion, or simply the back and front portion of the body. The second one is the transverse plane. A transverse plane is also known as an axial plane. This divides the body into cranial and caudal, or the head and tail part of the body. And the last and the third one is the sagittal plane. Sagittal plane can also be called as lateral plane, in which divides the body into sinister and dexter, or the left part and right part portion of the body.
Before we proceed to the next, let us first define what is physical wellness, strength, and flexibility. Physical wellness.
Physical wellness refers to your physical appearance of your body. It is an important state of well-being and capability of each individual. It measures strength and flexibility because if you are physically well, you have the strength or the power to do to do or perform vigorous activities, and also develop your muscles flexibility.
Strength. Physical strength refers to a person's ability to exert force on physical objects. Flexibility. Flexibility is the ability of a joint or series of joints to move through an unrestricted, pain-free range of motion. Now that we have mentioned flexibility, our next topic to be discussed is the four basic movements in flexibility. Abduction and adduction. Abduction moves the limb laterally away from the midline of the body. Adduction is the opposing movement that brings the limb toward the body or across the midline. Flexion and extension. Flexion is an anterior bending off neck or body.
Example: angle at the humerus of arm and scapula bone decreases as arms move anteriorly.
Extension involves a posterior directed motion.
Angle at the humerus of arm and scapula bone increases as arms move posteriorly.
Before we move to the next, let us first define what muscle endurance, cardiovascular fitness, and body composition. Muscular endurance. The ability of a muscle or group of muscles to perform repetitive contractions against a force for an extended period of time. The more muscular endurance you have, the more repetitions you can complete. Cardiovascular fitness refers to the ability of your cardiovascular system to deliver oxygen to your muscles and for your muscles to use oxygen to provide energy for sustained periods of physical activity. Your daily activities will be easier to complete if you have good cardiovascular fitness. Body composition. Doctors and health professionals frequently use term body composition. It refers to your body's fat, bone, and muscle percentages. The next and the last we'll be discussing is about the types of stretching.
We've all heard or read about the importance of stretching. Stretching can help you improve your athletic performance, your overall health and wellness, or relieve pain and tension. The real question is, what types of stretching should we do to achieve the best results?
1. Static stretching.
This is the most well-known type of stretching and has been considered the norm for many years. This type of stretching may not be the most effective way to improve performance prior to physical activity. Static stretching before engaging in physical activity may impair the muscle's ability to fire properly.
2. Ballistic stretching.
The force created by the bouncing inhibits the body's stretch reflex and increases the muscle's range of motion.
3. Passive assisted stretching.
Your stretching routine is completely led by a partner, allowing you to relax your body in that position.
Before we proceed to the two practical principles, let us first define movements. Movements. Basic movement skills are very important to an individual. If students are properly taught the basics, they will be confident and competent enough to develop complex movement skills. To practical principles.
2 practical principles. 1. Use all the joint that can be used. The forces from each joint must be combined to produce the maximum effect. Principle 1 states that we should first move well, then move often, seek a qualitative minimum before we worry about quantities. If moving well is the standard, moving often is the foreseeable outcome. 2. Use every joint in order. This principle tells us when the joint should be used. Movement should begin with the big muscle group and move out to the progressively smaller muscle from big to small. Principle 2. Direct as to protect, correct, and develop the movement of those or care.